Gastric bypass surgery is the historically most common, most well-known of the bariatric procedures. However, most people really don't understand what it is. They understand the name of stomach stapling, they've heard of a Rui procedure, they know there's a Y involved, but they don't really understand the procedure except the idea that it leads to weight loss. Well, it leads to weight loss very well, and it's been done since the mid-1970s. And really what it boils down to is a change in the GI tract so that you can affect your ability to tolerate food. You're full on a much smaller amount of food, and that food, when it sits in your gastric pouch, leaves you very satisfied for a longer period of time. I like to talk in terms of models, and I like to talk in terms of scale because I deal with 3 dimensions all the time. And this is a scale model, although small, of a stomach. So the esophagus leads into the stomach, which then leads into the small intestine downstream. What we do with a gastric bypass is we identify the upper part of the stomach. Based on the lesser curve of the stomach, this part's not stretchy, this part is very stretchy. But based on this part, we will make an incision across here and cut the upper part of the stomach into a small portion. Now, anybody has the ability to use this model at home. If you take your thumb and stick it up in the air, that's your esophagus, roughly equivalent to here. If you look at the muscle beneath your thumb, that circle, that's about the size of the gastric pouch made during a gastric bypass surgery. You look at that and you say, how the heck can anybody survive with a stomach that big? You'd be full in no time. Well, you are full in no time. You're full very, very quickly. And that is literally the size that the stomach is made. But you don't stay full because we make an outlet. We make a small hole in that stomach and we attach a piece of intestine that we bring from the lower abdomen up into that stomach pouch. And the attachment is about the width of my pinky finger. So you have that small stomach and you have that small attachment. So if you eat a piece of pizza and you don't chew it well, it's going to come down into that stomach and it's going to sit there. And it's going to be uncomfortable because it cannot go through that small hole. And it's going to stretch that stomach. And you're going to feel very, very full for a long period of time. Probably over full. And you may actually regurgitate and you may throw it up. But what happens during that circumstance is you learn, I can't eat without chewing well. And I know I have to slow down because you don't want to feel uncomfortable. And as you get to the point where you can start to figure out how much is enough for that stomach pouch, you feel very, very satisfied on a small amount of food. Most people will eat less than an entire egg in their first several meals after surgery and feel that they can't eat the remainder of the egg. That's 1 egg. That's not a 3-egg omelet. That's 1 egg. It's mind-blowing to understand that you can live with a stomach that is that small. But in fact, our patients live. They live beautifully, they live well, they live for years and years and years. And there's a reason why this procedure was done since the mid-1970s. Because it works. Because people are safe and healthy afterwards. The stomach by its nature is a layer of 3 different muscles and they slide on each other. So that small stomach pouch does get to the point where it stretches to a certain degree over time. And instead of being able to eat half a sandwich only for the first 6 months, you can probably eat the second half of the sandwich about a year out from surgery. But most people start to panic when they get to the point where they can have that second half of a sandwich because they're very happy with the idea that they're satisfied on a small amount of food. They pay attention to the quality of the food that they eat, they pay attention to the level of satisfaction that they have when they're full, and they love their procedure.